New tonight, the medical community is reacting to the CDC's updated guidance for people who contract COVID. Earlier today, the government agency slashed the recommended isolation time in half for asymptomatic people. But some doctors are expressing concern. 12 News reporter Kim Kalunian joins us now with their reaction and what these new guidelines mean for you. Kim?
Well, asymptomatic people with COVID are now being recommended to isolate for just 5 days, a move the CDC says reflects science that shows people are most infectious 1 to 2 days before the onset of symptoms or 2 to 3 days afterwards. But some say the move is hasty. After a holiday weekend where airline staffing shortages caused by rising COVID cases left travelers stranded at airports, the CDC is once again loosening COVID isolation and quarantine requirements. In an announcement Monday, the CDC says asymptomatic people with COVID can now isolate for 5 days and should wear a mask around others for an additional 5 days. For those exposed to COVID who are not boosted or vaccinated, the CDC recommends a 5-day quarantine followed by another 5 days of mask wearing. Those who are boosted can skip the quarantine altogether, but should mask for 10 days. Symptomatic individuals with COVID should isolate until they test negative. Aaron Bromage, professor of immunology at UMass Dartmouth, called the changes reckless on Twitter, sharing these pictures of an asymptomatic patient's rapid tests, one with a faint positive on day 0, another with a darker line on day 8. He says they show the person still has a large amount of virus in their nose well beyond the 5-day recommended isolation period.
We have yet to see anybody turn antigen negative, so be non-infectious at 5 days.
Bromage says he's baffled by the CDC's decision.
And so it seems to be born more out of not having disruptions at work than it does seem, about the economy, than it does seem to be about stopping its spread. And that may be where we are right now. There is just going to be so much virus around that, is it possible to really, is this going to be any benefit by making them stay locked up for 10 days? And someone's made a calculated decision with this.
In a statement, CDC Director Dr. Rochelle Walensky says in part, quote, "The Omicron variant is spreading quickly and has the potential to impact all facets of our society. CDC's updated recommendations for isolation and quarantine balance what we know about the spread of the virus and the protection provided by vaccination and booster doses. These updates ensure people can safely continue their daily lives." And this updated CDC guidance is just that, guidance, meaning it's not a mandate, rather a recommendation that employers and states can choose to follow. In the newsroom, I'm Kim Kalunian, 12 News.